My name is Stella. Name is Griffiths. I stay in Hobabus. So I work for CoHeNa, basically Advanced Community Healthcare Services, Namibia. It's an organization that is in Omaheke, Comas, and the Hartop region. So basically, what we do is we work with the community at large. So we are there to step in what nurses cannot do. So we go out in the community, we do health education, we test the community for TB, we refer them for HIV testing at the clinic, and then when they are tested positive, we go out again in the community for them to be started on TB medication. And then we also monitor them for those 6 months that they're on TB treatment so that they can get cured and not spread the disease to others also. So basically we do what we call DOT. It's a direct observed treatment. So we observe as the patients are taking the medication. I participated last year, October, here in Hobabus. The moments that I can remember that was joyful for me was the group walks. So it was in a way, we were taught in a way that we can really understand what is going on because they were demonstrating with fruits and it was much of group walks so that we can actually understand what was going on. In my own lab, really, I have changed a lot of things since I came from the training. I even came to an extent of buying myself a skipping rope because really I was lazy. I didn't do anything. I was just eating and sleeping after work. So at least now after work, I'm doing my skipping rope, a little bit of some exercises in the room, and then also the way I was eating. Yeah, it really changed. So like first I was putting in 5 teaspoons of sugar and it was too sweet, but I didn't realize that it was not healthy for me. But after the training, I reduced. My mom, she was having a backyard garden, but for her it was actually a garden of flowers. She was putting in different flowers and beautiful trees with flowers. So when I went for holidays to her, I just gave her a short training of this and I was showing her in the book what she should have in her garden and those type of things. So I even helped her to remove the flowers and then put few onions, root beads, these small things that we can really afford. So when I went there December, because the training was in October, so January, before the school started, I went and I checked up. Really, the garden was processing and I could see that really she changed. After having this knowledge of nutrition, how babies should be brought up and all those stuff, and with also the resources that I received, I went out there and helped the community. So in my health education sessions, I always make sure that I have a part that I can put in whether it is about nutrition, the food types, and how the babies should be brought up and all those. A few of them are now putting up backyard gardens. Yeah, so they're trying to put up their own onions, their own small Spanish garden and so on. Although we have a lack of water, but really they are trying. And also the community is now taking their kids to the soup kitchens.